Welcome to the Friday Focus. My name is Dr. O from E&S Orthodontics, and I want to be the first to wish you a happy Labor Day weekend, and I hope you have safe travels wherever you may go. So this week what we're going to be talking about is the question about how long does treatment time take, and how long does the average treatment time take in our office. And so that kind of varies from person to person depending on each person's own specific problem. But the average amount of time that our patients are in treatment is about 14 to 18 months. And that's for relatively quick, simple cases. And then typically those treatment times can extend out to about 24 months. But we've, over the last year, we've introduced different ways to reduce the treatment time. And I've talked to you about those ways. One of those ways is using Propel Orthodontics. The other one is using Excellident. And so we're always... And then the third way was using custom braces to reduce treatment time. So if time is a big concern for you, that is one of the things that we've been addressing over the last year, is how to make treatment time more quicker and more effective. And so if you compare our treatment time compared to, say, using traditional braces, so if you remember, or if you've seen a couple of our Friday Focuses, we employ the Damon system in our office, and so what that allows us to do is, in essence, reduce the amount of time people are in treatment, but more importantly, it also allows us to treat in a more comfortable way. And what that means is we're able to use light forces over a longer period of time to get the desired movement that we want. And I know that if you know me, and if you've been in the office over the last year and a half, you know that I've been talking about getting braces put on. And so last week, I actually got my braces put on for the first time. And it's not my first time in treatment, it's actually my fourth time in treatment. And it was really funny. I want to just share an anecdote with my wife called me up and didn't know I was getting braces put on, and I got the braces put on, and she's like, "Oh my God, you're going to be able to experience what other people experience." And being this my fourth time in braces, it's my first time in Damon treatment, and I said to her, I go, "I think I'm going to have lack of empathy with my patients." And she goes, "Why?" I go, compared to traditional braces, the amount of discomfort or what I've experienced so far is far less than what I experienced in my 3 previous treatments. And so I hope that doesn't, for all the people who say, "Oh my God, this is the worst thing ever," I'm enduring it with you. I'm going through the experience with you. And so keep abreast. I'll keep talking about my orthodontic treatment as I go through some of the Friday Focuses. But for the first week, it hasn't been bad at all. The biggest thing that I've had is my son, on the first day that I had braces, I put him in timeout, and he didn't want to be in timeout, and he lifted his head and he smacked me right in the middle of the face. And so that was the most traumatic thing that I experienced during my first week. So listen, have a great Labor Day weekend. Again, if you're interested in knowing more, like how long you would actually be in treatment, again, we have ways in the office to reduce it, so we can get your treatment down to 6 to 8 months, depending on what systems we employ. But the average amount of time we're in braces usually is about 14 to 18 months. Some treatment can take up to 24 months, depending on the severity. But we can give you a sort of a guide of how long it would take you personally, because every person's different. And then, like I said, Damon treatment usually takes about 6 months to 8 months less than traditional orthodontics using traditional braces. Again, have a great weekend. We look forward to seeing you next week at the next Friday Focus.